Last July, we brought you news of Dr. Suresh Kattakkar's departure from the BC Cancer Agency's Centre for the North. Details quickly came to light of an investigation into the care of his patients after it was determined he had not followed proper protocol. Today, those findings were released.
The investigation into Dr. Suresh Katakkar revealed serious findings. The investigation was launched in May of 2012. At the same time, the lead medical oncologist for the Northern Cancer Centre was suspended.
Last year, we got a complaint about the practice of a physician. We investigated. The BC Cancer Agency is about patient safety and quality. And so when a concern is raised about quality or safety, you need to look at it, and that's really what we've done.
Katakkar had first arrived in Prince George in January 2011. During his time working with the BC Cancer Agency, he treated 540 patients. The review into his work by oncologists throughout the province reveals 10% had received non-standard and unacceptable care.
We try to achieve quality and safety by developing protocols, treatments that are the best in the world by looking at the literature, asking the experts what's the best treatment. If one seriously deviates from the quality, then we call that unacceptable care.
The report says 8 of these cases resulted in serious patient safety events and 4 cases involved potentially preventable treatment-related death.
The standard of care was not provided to these patients, and at level 5, a critical incident indicates by definition that the deviation of standard of care might have contributed to an earlier death.
The BC Cancer Agency says patients who had received non-standard care were immediately contacted.
For the 54 patients, some of those patients have died. For those patients that are alive, we have contacted the families as soon as we realized that there was a deviation from the standard of care, and appropriate measures were taken to get these people back on the standard of care treatment.
The report reveals 4 issues from Katakkar's work, including misdiagnosis, incorrect protocols, failure to heed warnings from colleagues, and failure to follow medical standards. Contributing factors included a lack of orientation and problematic workload management.
We have provided some recommendations, specific recommendations, and I think that our first and foremost task is to implement these recommendations, and we've started to do that.
The BC Cancer Agency is implementing 9 recommendations, including an improved orientation process and safety audits at the Northern Cancer Centre. Aileen Mateshall, CKPG News.